Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi. Today's podcast is going to be really interesting. It's going to be on a topic we've never covered before because it's a really new thing that's out there and one that we're all really learning about. So I'm excited to have Kandi Pickard from the National Down Syndrome Society on, as well as Dr. Brian Chicoine, who, both of them have been on the podcast before. But Brian, I think we have to call you friend of the podcast now after this many times you've been on. But for those who don't know you all, perhaps we can have you guys share a little bit about who you are, what you do, and what it is that makes you love working with this population. Kandi, we'll start with you.
Sure, absolutely. No, thank you. Thank you for having us, and it's exciting to be back. So for those that may not know who I am, my name's Kandi Pickard. I'm the CEO of the National Down Syndrome Society. I started with NDSS over 10 years ago, and I've been in my current role as CEO for the last, gosh, I think we're coming up on almost 7 years, which is
Wow.
wild to think about. But what brought me into the community is I have a 13-year-old son with Down syndrome. So when Mason was born, I got involved in our local community and had the opportunity to join NDSS. And this last 10 years, it went by really fast. So it's great to be part of the community with both of you and then obviously all the people that we serve.
I love it. Yeah, Candy's been on the podcast before sharing when we did our Meet the Nationals series that we did on the podcast, and she shared about NDSS on that podcast. So go back and take a listen to that. And then Brian, share a little bit about who you are and what you do.
Great. Again, thanks for having me on. I'm Brian Chicoine. I'm the medical director of the Advocate Medical Group Adult Down Syndrome Center. We're in Park Ridge, Illinois, a northwest Chicago suburb. We see adolescents and adults with Down syndrome. Many years ago, the families of people with Down syndrome in our community were finding that their children were getting good care as kids, but not as adults, and so they were looking for some place to get that care, and ended up. I eagerly took on the job, and it just took off.
Yes,
We've
and
seen over
it
6,000 people since then.
I was going to say it definitely has taken off. Anyone who's got a loved one with Down syndrome listening to the podcast, if they're an adult, you have heard about the Adult Down Syndrome Center in Chicago, and that really is an amazing thing of what they've been able to do for adults with Down syndrome, which actually is kind of a nice segue into what we're talking about today. Brian, along with NDSS, you guys have been working on something called Care Down Syndrome, or sometimes Care DS. It's called, and I wonder if maybe, well, you guys decide who wants to tell us about what is Care Down Syndrome. What is this resource that's been created?
Yeah. So CARE Down syndrome, so it does stand for something, Dr. Velotti. So it stands
Yes.
for clinical awareness, resources, and education. So that's what the CARE stands for. But this is a free online clinical education and resource hub for healthcare professionals and specifically primary care professionals because we wanted to provide a tool for them to understand how to provide high quality healthcare to adults with Down syndrome. And I can ask Brian to just share a little bit more about the course itself, but the reason that we worked with Dr. Chicoine to create this is we did a survey just over 3 years ago, and we wanted to ask families what their primary need was, and it came back just astounding, response of that. Families are looking for quality health care. They're looking for physicians, clinicians, resources or people that truly understand the unique needs of their loved one with Down syndrome, specifically our adult population, as we alluded to a little bit earlier.
Yeah, and I think, that's something, especially even within pediatrics, where we've realized that as good as the primary care doctors and other practitioners are in the community, to become really an expert or at least knowledgeable about what's out there in terms of medical needs for people with Down syndrome, it can be really hard to do. And Brian, maybe you share a little bit about from an adult perspective. Not everybody has an adult Down syndrome center in their backyard. Give us a little bit of a background that way.
Yeah, so that when they were doing the survey, they got that information. The other piece that, as we started talking to families and people with Down syndrome, the other piece that they were looking for was places where they could get care that was, delivered with dignity and respect. And so that
Yeah.
was, that those two were sort of the two highlights that we really tried to look at as we developed this program. But while NDSS was doing that survey, Dr. Santoro from Mass General was also doing a study that looked at only about 5% of adults with Down syndrome in the United States have access to a clinic for adults with Down syndrome.
Mhm.
So we really looking at that 95%, and how could we improve care? And I had talked with some donors, and the first thing was, well, let's get a clinic in every state in the union. That's ultimately, I think that's a wonderful goal, but that comes with a significant price tag,
Yeah.
and also getting uh, physicians and others that are well trained. So that I mean that's a I mean, I think a longer term goal. But in the meantime, really, how can we, get information in the hands of this 95% that are serving people in the community? And for me personally, 35 plus years ago, I was a family physician in a smaller community in Northwest Illinois, and I had a handful of folks with Down syndrome in the practice, and I do remember the first gentleman that what in retrospect developed Alzheimer's disease, but I really had no idea what I was, dealing with. And, having something like Care Down syndrome at that point would have been just absolutely wonderful.
Yeah, and I think you highlight something like Brian, where none of us go into any kind of medical training with the goal of coming out and being not knowledgeable about a particular segment of the population, and yet study after study shows that despite our good intentions, many people are not aware of the medical needs for people with Down syndrome and how to deliver it compassionately, as you were saying earlier. And so I really appreciate the heart of this Care DS project. So the intended audience. Well, actually, let's get a little bit deeper. Like, what exactly is going to be found on this in this Care DS resource library, Brian? What might be found there?
Sure. So at this point, it's I mean, I see it growing over time, but at this point, it's there's sort of three main things. There's a 2 hour course, and for physicians and others, it has free continuing education credits. It's a 2 hour course, and it really gives some good solid basics in a pretty concise manner. So in 2 hours, I'm not pretending that you're going to become an expert in caring for people with Down syndrome, but I think you have a pretty good sense of what it is that families and people with Down syndrome are looking for. And then there are reference articles in the second section, and those are more in depth. And you can also get free CME credit for reading those, which physicians all need. That continuing medical education, but those are more in depth. And then the third piece is what I really call resources, and so it's really, when a physician or other professional is seeing a person with Down syndrome, they're going to want to give them information, so that they can participate in the health process. And so there's a lot of resources for NDSS's resources, from our clinic's website, and many others resources from many other places. So there's really a lot of good information there that the physicians can use, or other health professionals can use themselves, but also they can share with the families and people with Down syndrome.
Yeah, and I wonder too, as you're describing that, every year we get together as all of the people who take care of people with Down syndrome in our Down syndrome medical interest group meeting, and we talk about the latest research. And thankfully, that seems to be a growing thing. Each year, there's more and more articles being published, medical articles being published on the appropriate and best care practices for people with Down syndrome. What's going to happen as that new information comes in? Is this going to be an ever growing library?
Absolutely. No, it's an evergreen piece. I think that we've got folks that just on our team that just continually monitor that and also are speaking with other medical professionals, be it DISMIG or other kind of folks that as we get this new information or different information, for us, it's not about recreating the wheel. We want to make sure that families and physicians and medical professionals, right, have accurate information that's updated. So it's something that we work on daily.
Yeah.
I think if I can add to the other piece of that is, I think for me that really one of the most exciting things about this, and we're so great to continue to work with NDSS on this project, but they really did do the work that it took to recruit and get. There were about 40 health professionals involved in this. We're talking about me and NDSS. It wasn't just NDSS and me. This was a very large group of individuals that were participated. It's peer reviewed, so that people are, one or two, three, four people are writing an article, and then similar number are reviewing the articles. And to your point about updated research, did you think about this article? Did you think about this thing or this that? And then so even in the first go around, we tried to make it peer reviewed and as thorough as possible. But then it's an ongoing process. Even before when I finished year one, we're working on year two, and then so what new articles, what topics have we not covered? For example, Alzheimer's is one of the topics from the first year, and we're going to update that already, even after just 1 year, because there are some newer things we wanted to make sure we included. So I think it really is it's a project that I don't think has an end,
Yeah.
unfortunately.
Yeah, that's great. Yeah. And I guess, since most of our listeners are going to have either be someone with Down syndrome or a caregiver or a loved one, somebody who's not necessarily in the medical field, although we do have quite a few medical practitioners out there, and I'm so glad to have them on board as well. But I want to have you guys speak directly to that person who is just someone who goes to the clinic and sees their doctor for their visits and gets their medications and whatever else that they need. How can they help get this information out into their doctor's hands?
Absolutely. Well, I think it's twofold. I think that number one, this is a resource for them. So as Dr. Chicoine mentioned, right, like Alzheimer's disease is one of them. We have topics around weight management and other types of things that I think is information that families are looking for. So I think it is a resource for them as well. But I think that we need their support, we need their help because we want them to be able to take this resource and take it to their next doctor's appointment and have this conversation with their primary care provider. And I think that that's just a very valuable way to, again, to empower our families to be able to have that conversation to say, here's a resources and here's more of what I need, right, as a patient within your care. I think ultimately, too, as we look at the broader scope of this, as Dr. Chicoine said, right, we're on phase one, and I think it's important to say that we primarily chose to focus on adults right now because there is other resources out there on pediatrics that are really well done, and so we wanted to kind of take a look at an area that's lacking a little bit of that information. But I think we also want to make sure that the families and caregivers and everybody knows that we can be there with them. And so if their physician is saying, wow, this is great, I would like to get this within our clinic or do a training, I always like to offer Dr. Chicoine's time and energy and effort here. But I know that he'd be more than willing to go and do grand rounds with somebody or to sit and have a Zoom conversation like this with the physician so that they can physician to physician, right, better understand. And we're happy to do that with a care coordinator or something like that too, so that this physician or clinic or hospital system, whatever it might be, truly understands the benefits of bringing an education or a training like this into their community.
Yeah, definitely. Go ahead, Brian. Yeah.
Kishore,
Yeah.
when I present to people with Down syndrome or their families, I apologize for the health community. I said, it really should not be necessary that you share this with your doctor.
Mhm.
But as you mentioned earlier, as a medical community, we have not really done our job as well, making sure that people come out of medical school or residency training well prepared to take care of people with Down syndrome. So, I mean, that is the state of the union, so to speak, at the
Mhm.
moment. And so, the plus in the Down syndrome community, first it was the pediatric guidelines and then the adult guidelines and other information. Families and people with Down syndrome have been very good about sharing information with their health professional. And whether it's their physician or OT or whoever the case may be. And so this really is another opportunity, and we've just tried to provide a solid tool that they can share and that a physician or others can use in a rather quick fashion, but get the thorough information that they need to do good care.
I love it. Yeah. And I love the fact that, it's offered for free. I'm sure that there's a lot of folks who have come behind this project because no project like this comes together for free. But are there other ways that people, or maybe even people who are part of larger, corporations or whatever, are there ways that they can contribute to allow this program to continue to grow?
Yeah, well, thank you for sharing and asking that too. I think that we have to, really thank, the Mike and Linda Musalam Foundation. I mean, they really helped underwrite a, majority of the expenses to get this going. And so we're grateful for that support. But as Dr. Chicoine mentioned, we're just on phase one. We have lots of ideas. We want to continue to grow this. So you can visit careds.org and make a donation there if you feel so inclined to do so.
Wonderful. Well, before I close the podcast, is there anything else that you guys wanted to make sure that we brought up today, or anything that any parting thoughts you want to leave for any of our listeners?
Well, I'll just mention, I think that as we talk to families and NDSS, that's like really right. One of our biggest priorities is trying to meet the needs of what our families are asking for. And so I say that because I know even personally for me, the closest clinic that I have is over a 2 hour drive to be
Mm,
able to go see somebody who truly understands Down syndrome. And so we're hoping that this is a resource for our families and it helps bridge a little bit of that gap that so many families have, and that they reach out to us too. If there's other topics or if there's other information that they're looking for, like let us know because we definitely want to keep an ongoing list of things that they feel is important to share with their primary care provider.
love it. Brian,
And I
anything
just
you
want
want
to
to?
say,
Yeah.
yeah, I just want to say thank you for doing this. I really appreciate you helping us get the word out. I so appreciate your podcast. I'm regularly referring patients and others to, you got to go listen to this episode or whatever.
Uh-huh.
But this is a great, I do appreciate that this is, the large chunk of your audience are families, and that's really one of the people we want to hear about this. And so ask them to just please share it with other families, and everyone share it with their health professional, and hopefully we can keep getting the word out and see the needle keep moving forward and getting good health care for people with Down syndrome.
I love it. I love it. I will definitely include the website in the show notes, of course, for folks. But it's a pretty simple website. I think it's careds.org. And
Correct?
yeah, perfect. Okay. And so that'll be in the show notes as well for you to share with your primary care provider. Listen, it's a free resource, and it gives your practitioner the medical education credits that they need anyway in order to continue to renewing their licenses and all that kind of stuff. So that's a great thing. We very rarely get free CME options that are actually this useful. So that's fantastic. So thank you all for the effort that it's taken to get to this point, and looking forward to future phases as it moves forward. To our listeners, we are always so glad to hear from you all. If you want to reach out to us with any topics that you want us to cover on this podcast, send me an email to Down Syndrome Center at chp.edu. And if you want to contribute to what we do at the center, including the work of this podcast, you can go to givetochildrens.org/Down Syndrome Center. But until next time, bye bye.